Hi, this is Dr. Nisha Vishnu, consultant radiation oncologist. If you or someone known to you has been advised to undergo radiotherapy during the course of treatment of a brain tumor, this video might help you to overcome a lot of fears and be prepared for the treatment. In most cases, radiotherapy to the brain is administered after the surgeon has operated and taken the tumor out. However, in a few cases, radiotherapy may be the sole modality with or without chemotherapy for the treatment of brain tumors. And sometimes radiation is given as a palliative measure in case the brain tumor is a spread from another cancer elsewhere in the body, like a breast or a rectum or a lung. Treatment duration, dose, and hence the side effect profile varies very widely from person to person. Most of the side effect usually starts in the second week of the radiotherapy, are temporary, and settles down in due course of time after the radiation therapy. One of the most common side effects is tiredness or fatigue or a general lack of drive. This may be accompanied by nausea or vomiting and loss of appetite. Severe headaches persistent in spite of pain medication prescribed by your doctor, vomiting not controlled by the first line antiemetics, especially accompanied with the blurring of vision or loss of consciousness or sudden loss of power or severe confusion or change in the behavior. All these need immediate medical attention or emergency care. Having said that, some amount of headaches on and off, nausea and vomitings are common in brain radiation. The severe types usually arise because of the increasing pressure inside the brain and needs decompression either with steroid-like medications or rarely surgery. I have noticed a lack of alertness in some of my patients and imbalance as well. That is why we usually advise our patients against driving or performing any activity that requires alertness and balance like contact sports, swimming, etc. during and as long as your doctor feels to avoid injury to self and others. I have seen a few of my patients experiencing patchy hair loss due to radiation affecting the scalp. Please make sure you do not apply any oil or cream during radiation. Just clean your hair with mild soap and water. The hair loss is sometimes permanent, but mostly it is temporary. Memory loss is one of the dreaded side effects, but we do not usually see the kind of drastic amnesia that we see in the movies in our setup. There might be slight confusion or minor loss of memory, that too in some cases. Fits or seizures are a very rare side effect of radiation, and I would rather say seizures could be because of the disease itself rather than the treatment. Nevertheless, it is better you know of it, and sometimes your doctor might even prescribe you an anti-epileptic medication or an anti-seizure medication. Similarly, loss or decrease in the power of the upper or the lower limbs, the hands and the legs, might be there sometimes depending upon the position of the tumor in your brain. Mood swings and change in behaviors have been reported by several of my patients, family members. I think brain is very mysterious in several ways, and problems in brain might emanate in unexpected ways. Empathy, restraint, and a mature approach from the family is equally important for the smooth sail of the patient through the treatment. And in case there is a need for counseling to help you tide through the treatment, please do not hesitate to get in touch with your doctor.